gridlock. And what I saw was that when the church partnered with the broader community through their nonprofit, they were able to leverage these outside resources and be able to have greater impact in the quality and the quantity of service. And at the same time, be recognized as a value stakeholder in the community. And so when important decisions were being made, they were invited to the decision-making table. As a Korean American coming out of the LA riots, where our community was hurt, out of the $1 billion in damage, almost 40%, no, 50% were incurred by Koreans, and yet we were standing alone with no friends to cry with us. And this is where I realized that the power of partnerships, the power of engagement, and having many friends was such an important piece. And when Josh Dixon, the National Faith Engagement Director, reached out to me to say that they were also wanting to engage the Asian Christian community in terms of the outreach, I was ready to say yes, because these relationships are so critical, particularly as an Asian American. The model minority myth really hurts our community. And we are consistently left out of the decision-making table that leads to funding decisions, program decisions, outreach decisions, and so much more. And, we wanted to have these listening sessions to showcase the leaders in our community, and that we have something to say and we have something to contribute. And out of these listening sessions, key issues started to arise. And of those, one of them was healthcare. And I want to just say that, especially in this COVID environment, Asians play such a disproportionate role in terms of service as essential workers, frontline workers. And so really in that way, we're impacted. And also, if you look at the COVID death rates in the major cities, like 6 of the major cities, 6 states, Asians have a disproportionate death rate, significantly higher, 4 times higher than the average population. And in LA County, we actually had the highest death rate in May, and yet no one seems to lift our concerns. And so today's panel, we want to be able to showcase and lift up and advocate what are the concerns, where are those gaps, where our community is hurting, and be able to advocate for that, so that if and when President Biden wins, that these issues will be very much part of our national policy. And so with that, it is such a privilege to first invite our next speaker, Dr. Vivek Murthy. He is the 19th Surgeon General serving under President Obama. And he also served as the former Vice Admiral for the Public Health Service Commissioner Corps. In addition, he founded a nonprofit called Doctors for America in 2008, as well as he served as, he was also the first Surgeon General of Indian descent, and also the youngest active duty flag officer in uniformed service. If you look at his bio, he has all the Ivy League that every Asian parent envies of their child, Harvard, Yale, whatever, right? And so again, it is such an honor to have Dr. Murthy join us today. Dr. Murthy. Oh, your microphone needs to be unmuted.
Thank you so much, Hyepin. I really appreciate that very kind introduction. And I'm really thrilled to be here with all of you who are joining. I know that this is a really tough time for a lot of people who are struggling to figure out how to telework and homeschool your children and take care of your parents during these difficult times when there seems to be risk everywhere with the coronavirus. So it means a lot that you made time to come onto this call. It's especially good, though, to be with you this evening, because this is a time of extraordinary importance for our country and truly for the world. And I was listening to Hyepin's story, and I felt, a certain kinship to it, because, like many of the people on this call, my parents too are immigrants, who came to this country from faraway shores. They came from India, and they eventually made their way to Miami, which is where I was raised, in Miami, Florida. And it's actually where I speak to you from right now. We've been quarantining here with my parents for the last 6 months. And the table at which I'm talking to is the same table at which I did my high school homework for many, many years. Wow. So it's all come full circle. Yeah. But I'll tell you that, when my parents came here, we didn't have much in the way of money or connections. We came here fueled by a dream that in America, that my parents would find a country that would be a home and a community for all of us, and that it would be a country that would judge us, my sister and I, not by the fact that we had funny sounding names or the fact that we look different or the color of our skin, but that their hope is this would be a country that would judge us based on our willingness to work hard, our ideas, our willingness to be a part of a community and to contribute to society. And what they also, even though we were poor when it came to money and sort of connections, we did have something that made us really quite rich. And that was our love for each other and our faith in God. And those are the greatest gifts that my parents have given to me over the years. Because those two forces, our love for each other and our faith in God, really saw us through all the days and the years that followed. And they were great moments. We had great moments of joy and success, but we also had darker times, like when we experienced a really difficult car accident that hospitalized my sister at a young age, when my uncle took his own life, actually, through suicide, when we lost our life savings to a man that we had considered a friend when I was in college. These are really difficult moments, but it was that love for each other and our faith in God that really saw us through. But one of the most important things my parents taught me that's relevant to tonight, that I think is deeply relevant to this election and as the heart of who Joe Biden is they taught me that the spark of the divine is in each and every one of us without exception. And regardless of whether we like someone or agree with them, that they have that spark of God within them. And for that reason, they also taught me that when we serve humanity, when we seek each other out with a desire to relieve suffering and to care for those less fortunate than us, that is one of the most important forms of worship that we can render. And I know that many of you share that value. I know that because I know how many of you on this call have devoted yourself to serving others, recognizing our common humanity, recognizing that we are all children of God. But another person who shares this value is Joe Biden. And I say this because I've sat with him every week for many months now, and often multiple times a week since this COVID-19 crisis began, as we've talked about the trajectory of the virus, the toll it's taken, but also strategies for how we're going to get through this coronavirus crisis. And I've seen his concern for those who have been hardest hit by COVID, seniors, minority communities, and those who are economically disadvantaged. I've also heard the frustration in his voice and the disappointment as he's seen just how many lives we've lost and how many more people have suffered with this terrible illness, especially given the fact that so much of this suffering was avoidable. The truth is that his concern for the welfare of people long precedes this virus. And in my opinion, there's no place where that is more clear than when it comes to health and the work that he's done to advance ambitious health policies that have helped to really extend coverage in historic ways through the Affordable Care Act, where he partnered with President Obama to make that a reality for tens of millions of people. But also he's recognized that we've got more to do, not just to address COVID, but to fill the holes that have existed in our healthcare and public health system far before the pandemic began. And that's why he's put forth a really ambitious plan to provide affordable coverage to millions more Americans. He's put forth a plan to reduce drug costs, to strengthen our public health infrastructure, to ensure that when it comes to long-term care and home and community-based care services, when it comes to serving those who are disabled in our communities, that we are doing better by them, that we are providing better services. And we're ensuring that at all stages of life, from when you're a child to when you're an adult, in middle age, to even toward the tail end of your life, that the system is there for you, that the country is there for you to take care of you, make sure you're well. I mention all of this because this is all what's at stake in this election, because this election is a lot more than about a virus. It's also about much more than a health plan. This election is about what values you and I choose to live by. It's about whether we choose to speak up for and stand up for the vulnerable and for each other. It's fundamentally about what kind of country we want for ourselves and for our children. And I say this having two small kids myself now who are 4 and 2.5. And my wife is Chinese American, I'm Indian American, and we feel so grateful that the Asian heritage that we've been brought up with is now flowing through our children. And we're trying to bring them up with so many of the same traditions and stories that we had. But we also know that in this, our home, America, that the values that we choose in our elected leaders matter. They matter a great deal because they're going to affect the kind of world that our children have. And the real question is, will our kids inherit a world that's compassionate, that is kind, that's loving, the kind of world where we look out for each other, where we take responsibility for each other, the kind of world where we recognize that together we can do more than we can do alone, and where we recognize that the spark of the divine is in each of us. That's what's on the ballot this November. And it's why I'm so grateful that all of you are working so hard to come together and support Vice President Biden and Senator Harris. And with your grace and hard work, my hope is that we will have them in the White House and we'll be able to roll out the kind of plans and policies that will truly reflect our values in how we treat the most vulnerable among us. So thank you so much.
Thank you so much for your inspirational words. It gives me hope knowing that there's leaders like yourself in position, and hopefully again President Biden will be there. And I don't know if there's a role beyond Surgeon General, but we hope that you will be there as well. So again, thank you so much, and God bless you. Thank you so much.
Thank you so much. God bless you all as well. Take care.
Bye. Thank you. So at this time, I am very pleased to introduce our two MCs. And so first, Al is an ordained minister of the Evangelical Covenant Church and also an affiliate professor at the North Park Theological Seminary. And also then Reverend Jana Louie, they're both reverends, is an American Baptist minister who is currently based in Los Angeles. And actually, you should look them up because there's much more to their bio than what I'm able to say publicly. And so with that, I just want to say again, please help me welcome Jana and Al. Thank you.
Thank you. It's good to be here with you all. Reverend Al, would you like to say hello as well? Or?
Yes. Welcome, everyone. Thank you for the privilege of moderating this town hall.
Well, at this time, we are grateful for Reverend Pula Ala Alima, who will open us in a word of prayer.
Talafalava, marulile, aloha. Let us begin by breathing deeply. Breathing deeply. And in the fullness and the flow of breath, let us pray. Great Akua, Le Tangaloa, Creator, Sustainer, O breath of aloha, breath of love, O breath of life, we thank you. Mahalo nui loa for breathing us into this sacred moment, in this holy virtual space, breathing each of us in this gathering of the beloved community. May we listen to your voice, calling us to hear the cry of the disinherited, the vulnerable, the wounded, longing for healing, for hope, for justice, for freedom, for peace. From our places of origin, from the corners of Asia, the Pacific Rim and basin of Oceania, from this country that we call home, and throughout the world, we lay open our lives to the movements of your spirit. Tossed about in a sea of uncertainty, hopelessness, and fear, we pray. We pray for your firm rock foundation. We pray for your constant ground of love to keep us steady, to keep us calm. And may we move from this place and this moment with clarity of where you stand, O God, of your position and your call that shall be our guide, informing our actions, informing our lives with the fullness of your kingdom, your realm, your living breath. Anoa I kākou ma kai noa ka makua. A me ke keiki. Amen.
Amen. Nothing like a heartfelt prayer to center us and to help us align our time together with God's. Thank you. So Jana and I do want to welcome you to this town hall on faith and healthcare. And in a moment, we'll be going to our panelists for their presentations. You know, there is so much ground to cover when it comes to healthcare in general, and specific health-related issues within the AAPI community in particular. Frontline workers, elderly care, domestic violence, trauma, mental health, abortion, COVID-19, and I can go on and on. And let me just say at the outset that there is no way that we are going to cover everything in the time that we have. Our panelists will bring their perspective to certain issues, and the hope is that there will be enough time for some Q&A a little bit later on. Now, our panelists are distinguished, and we publish their fuller bios in the material, but also in the chat. So we won't be introducing them fully here, but our first panelist is Mona Lisa Tuitahi, is an attorney and lay servant leader in the United Methodist Church. She will share some thoughts on Pacific Islander realities related to healthcare. Mona Lisa, what are the realities of Native Hawaiians and other Pacific Islanders that make healthcare uniquely challenging?
Well, thank you, Al. I want to thank you for the opportunity to bring voice and to be among you at this table. I want to start by offering just a slightly different frame for the issues and the question that you've asked, really by asking what is the underlying gift that undergirds the Pacific Island community, the lived out strengths that which sometimes create challenges and barriers in a new setting, if you will. To be specific, and I will just use, it is the love or aloha that binds the community together. And to use the Disney quote, which I will say without holding back, is a stinging cultural appropriation. It is, ohana means no one gets left behind. Or if I may, I'd like to borrow from the African lore, if you want to travel fast, travel alone. If you want to travel together, to travel far, travel together. It may sound cheesy and maybe cliched, but really it is a notion that pushes people to spread out their meager means, to congregate, to live in crowded homes, to live in multi-generational homes so that elders are cared for and youngsters learn from their elders. And so no one gets ahead of the pack, so to speak, but all are traveling together. Yes, it is also the cause for endless gatherings that is centered on food, because it brings out the very love and hospitality, and I see Pula laughing, that defines PI life and code of living.
Yep.
You have to have food for everyone, and you have to have more than you need, because this is the essence of Pacific Island hospitality, abundance that is not defined by limitations of means and goods. Yes, these are gifts of community founded in immigrant churches, and they find affirmation and sense of belongings there. These are all gifts, but they also become the barriers. They also contribute to the somber statistics that we hear so often and are so confounded with every day. Unfortunately, the lives of Pacific Islanders are generally smaller, harder, sadder, and shorter. The markers of poverty are prevalent in this society as in other societies of that. According to the United States Census Bureau, there are an estimated 1.4 million Native Hawaiian and other Pacific Islanders currently living in the US. This population suffers from the highest rate of heart disease, hypertension, asthma, cancer incidence, and diabetes in comparison with all other ethnicities. Despite having some of the highest healthcare needs, they also continuously experience barriers to accessing healthcare and utilizing quality services. The extreme health disparity indicated by high mortality rates and low life expectancy as result of the gift that I've mentioned, combined with disparities that are brought out by colonialism and other historical trauma. I'll say this, PIs are largely invisible. Our sense of community fits right into this pattern. We are content as long as we have each other, as long as we have food on the table and this month's rent. We need ethnic specific data necessary for developing strategies that understands this undertone, that understands who we are in order to help this sector and many other sectors that have the same issues, which are universal, I might add. We need our leaders to care, to want to see us, to know who we are, and to allow us to share our gifts with this country and with this world. An example of this is in the COVID reality. In LA County, rate of infection is 6 times higher than white people, 5 times higher than Black people, and 3 times higher than Latinos. I conclude, as I said, to end, I believe that the gifts I started with are critical to Pacific Islanders healing themselves. But understanding Pacific Islanders and other communities that are like Pacific Islanders is so sparse. And our leaders have not seen us for who we are. PRs are invisible, and the gap between where we find ourselves and the mainstream world is sometimes, unfortunately, seemingly like the big Pacific Ocean. We need increased and improved visibility and access to life, to liberty, and chief among that is healthcare. Thank you, Al.
Thank you, Mona Lisa. Thank you for that reminder to understand the larger we and the larger community that we're a part of, and the ways that our vote communicates the community that we see and that we understand and hold in our hearts. Thank you.
Thank you, Jane.
It's an honor for us to also have Dr. Christina Lee as our next panelist. She is a physician and a graduate of UC Irvine's Medical School. She also holds an MDiv from Claremont School of Theology. She is a mother to 4 wonderful children, and she's also a survivor of the war under the Cambodian communist regime, and reads, writes, and speaks Khmer fluently. So Dr. Lee, we would love to hear some of what you're seeing on the grounds in your practice as it relates to the API community.
So that is Cambodian for hello or greetings. And I'm very humble and honored to be among our brother and sister in Christ. And that reminds me of a quote that says, a different language is a different vision of life. And I'm so honored to be among the Asian community that consists of Korean, Filipinos, Samoa, Tongan, and, even Japanese. So it's the richness of life. And to me, that is a beautiful color tapestry of the Asian community. So I will be sharing today my experience on the ground, kind of in the trench, I say, of how, everyday life and lack of resource or lack of language can affect a person's outcome in health-wise, or like we have mentioned, accessibility to health resources, or even just other healthcare resources that are provided by insurance because of the lack of knowledge of the available programs. And it's, a lot of things that I see as a physician. As an orphan of the war that you mentioned in the Khmer Rouge, gone through a lot of struggles myself, arrived here in the early 1980s. There was not a lot of resource, a lot of familiarity or awareness of, where we come from as Asians, immigrants or whatnot. But today, thank God, there is a lot more awareness. And I find it's a blessing to be of an ethnic where I come from, where we are humble and quiet, but at the same time, it's a disadvantage. So this is why a community forum like this, and you organizing this kind of community, is hoping to give voice to those who are not able to speak. And I'm glad to be part of it. I just wanted to share my experience, and hopefully with the new administration and the programs that they may be able to make available to help lives improve and better. And so that brought me to another quote that our Claremont, President and Dr. Jeffrey Kwan, he put on there, and it really resonated with me as a life of a survivor. And I felt like God has given me a second chance to be of useful. Is that the purpose of human life is to serve and to show compassion and the will to help others. And it's by Albert Schweitzer, but Dr. Kwan put it on his email when I got the invitation, and it just resonated with me. And I, as a physician, I see that there's a lot of time people needed help, and there's nobody that either speak their language or have gone through the same culture or to understand what kind of regimen or what kind of treatment, because many times when we as a physician who are trained in the Western, school and tradition, we may not understand Hyepin has mentioned that her mother, unfortunately, have gone through some health challenges because they don't really understand. But see, because I've learned that, and I came from a country, for me, it was Cambodia. So there's a lot of high rates of, say, hepatitis. And so a lot of my patients who come to me, I will automatically order it for them. They don't have to ask for it because I know what kind of health risks they are at. And so many times I discover a lot of patients who had immigrated since 1980s until now 2000 don't even know that they have, exposure to it, and they actually have virus that are alive in their body, and they have other elements and they don't know. And sometimes it's not going to show up on certain blood tests, like the liver function test, but you have to really look. And then a lot of them are surprised, and actually some have been treated, but then yet they don't know that there are newer regimens of medications. For example, hepatitis C used to be very bad, and there's no treatment. But nowadays, it's even better treated than, say, hepatitis B. So there's a lot of education that they're lacking because there's just no avenue for them to reach that. And I'm hoping that in the future we will have some, fundings to help focus or target to the population that needed that so much. What? Some people don't even know the basic stuff, like, hey, if you're 50 and above and you're female, you should get a mammogram, or there's certain other, colonoscopy. They're afraid. They're so afraid. Number one, culturally, I've seen that as a culture, most women are very shy. And if they have a male physician, they do not want to address that. Or vice versa, if they're a male and they're coming to a female physician, they may not be as open. But it's the physician's job to be very proactive and tell them. And especially if you know that in I see all kinds of Asian populations, but especially the Cambodian, they have gone through so much trauma and so much anguish as a war survivor. They're afraid to open up, nor do they know how to ask. Or in another aspect of it, I see they do not want to know. They're scared to know, but yet they need to know that if we detect it early, we can save lives, right? Because they've gone through so much to survive in this country. And it's unfortunate if they have something that could be preventable. So other things that I see as a challenge would be even the language as to how to take medication, and they do not know how to read. So they will remember the shape and the size and the color of the medication. However, they do not understand that the manufacturer can make the same medication in different formats or different colors. And so many times when new patients come to me due to their language barrier, now that they know I speak their language and they come and I would review the medication, I find that they take the medication in duplicates. And some might be okay, but some are not, like diabetic. It could get their blood pressure, sugar very low, or blood pressure that can go really low. Many times I'm so dizzy. Well, it's because they're taking the same medication that looks differently, but actually the same name, or one is branded name and one's generic. So I see that there are a lot of challenges and struggles that are facing the Asian population due to language barrier or resources, because they don't know how to get to their physician, or there's how to talk to even just the nurses in the office, etc. So those are some of the challenges I see. And also, there's another thing that I think is very important, which has kind of been addressed, but not really fully, is the mental health issue. A lot of people are still looking at that as a stigma. They do not want to share, but at the same time, they do not realize that mental issue affect our population. Yeah. And especially for Asian population, we are either immigrants, we are either, facing a lot of financial status. Like I have a lot of patients who used to be somebody very important in our country, but when they come here, they feel very devalued. They do not feel like they are of any importance because they can't speak the language. They don't know what to do with their kids. They can't tell their kids what to do anymore. They feel very useless. And so they have depression, anxiety, resulting in insomnia. Yeah.
So many challenges. Thank you so much, Dr. Lee, for pointing some of them out. Very real challenges that tell us that to truly be a healer, for the welfare and the well-being of people, that there's just so much more to it than just giving a pill. There's the social and the economic and all of these angles. And thank you for that reminder. For our last panelist, but actually before I introduce our last panelist, I do want to encourage our participants to type in. I believe there's a Q&A section there that you can utilize to type in your questions for our panelists. So for our last panelist, I have the privilege of introducing Dr. Paul Song. Again, if I were to spend the time to read his full bio, it would take another hour or two. So Dr. Song is a physician, an activist, vice chairman and chief medical officer of NK Max America. And he will share some thoughts on the issue of access to healthcare, particularly how COVID-19 has impacted that access. Dr. Song.
Thank you so much. Can I have permission to share my screen? It says it's disabled.
Who is our host? I don't think I am. Or I would give it to you.
Actually, Hyepin, you have to do it.
Okay, so Hyepin is our host.
Hyepin, if you just go all the way to the bottom, it'll say under the share screen, you'll allow other people to share screens.
Or Hyepin, are you able?
Oh, there you go. Okay, perfect.
Okay.
Okay. Can everyone, let's see.
Yep.
Can everyone see that?
Yep, we can see it.
Again, thank you so much, everyone, for allowing me to be here. And I'm really just honored and privileged to be part of an amazing group of people of faith who have declared their support for Vice President Biden. Just to give you a brief primer in 5 minutes or less, I just want to say, first of all, some of you may know I was a national surrogate for Senator Sanders and a big proponent for Medicare for all. But I am fully convinced that Vice President Biden is the right person to lead us forward now, and he has my whole unilateral support. Just wanted to start out with this quote by Shirley Chisholm. So my mom came to the United States in 1951. She was a refugee during the Korean War. And the first person to hire her was Miss Chisholm. Now, Miss Chisholm was the first African-American woman elected to Congress. But before she ran for Congress, she ran a bunch of Head Start programs, of which my mom became a teacher. But then in 1972, she decided to run for president. And she said, "We have never seen health as a right. It has been conceived as a privilege available only to those who can afford it. And this is the real reason the American healthcare system is in such a scandalous state." And she said this in 1972, but sadly, these words still ring true today. Now, many of you have family members who go to church. My mom goes to church, and she's astounded that a lot of people that she considers of faith sort of speak this gospel, that you were hungry and thirsty, so I eliminated Meals on Wheels and food banks. You were a stranger, so I vilified you and demanded that you be deported. You were naked, so I called you an evil liberal who hates conservative family values. You were sick, so I repealed your hope for healthcare. You were in prison, so I tortured you. Now, again, this is a little bit extreme, but if you really look at the arguments being made to provide the basic social services and safety nets, it's hard to wonder if these people have ever read the book of Matthew. Now, the Affordable Care Act did a lot of great things. It got rid of pre-existing conditions. It expanded Medicaid, established tax credits. But certainly there were some things that were not optimal. There was no public option. There was no insurance rate regulation. There was no drug pricing control. But just to be clear, that I think if you asked President Obama what his plan was, this was supposed to be the starting point for which further administrations would try to improve and build upon the Affordable Care Act. But instead, even before Donald Trump took office, he was already, with the Republican Senate, going about trying to dismantle it. So if you look from the time he took office in 2016, in December, they did a Tax Cut and Jobs Act that basically repealed the Obamacare tax. They did away with, they put work requirements for people for Medicaid. They took away reimbursement for low-income deductibles and co-ops, and they basically taken away the individual mandate and done everything to undermine it rather than try to make it even better. And as a result, if you look, this is before COVID, the number of uninsured from the time that it went into law in 2008, you see it steadily going down, but in the last 3 years, the uninsured rate has continued to go up. And this is one of the challenges that we all need to take to members of our faith communities and really tell them what's happening in the community. In the states that are trying to institute severe anti-abortion laws, regardless of how you feel about that, if you are asking a woman to bring a baby to term, then you should be able to provide the adequate health care for her. But as a result, believe it or not, the United States compared. So if you're going to prevent a woman from exercising her choice and mandate that she bring a life, if she dies trying to do that because you don't give her health care, which unfortunately in a lot of the states that are really passing the most severe restrictions, they don't have Medicaid expansion. So many of these women are forced to carry pregnancies, but don't have any access to health care. Just to point out that, as I said, the Affordable Care Act did some good things, but premiums have continued to go up, deductibles have continued to go up, while inflation and wages have remained stagnant. And then if you look at the number of people that report they've delayed seeing a doctor because they couldn't afford it, and specifically in those with insurance, 1 out of 3 people who has insurance has reported that they have not gone to the doctor because they couldn't afford a copay or deductible. And if you look among the various communities, you know, the Asian community is not immune to this, but it's particularly tough on other communities of color. And then the last thing I'll say about that needs to be improved in the Affordable Care Act is that prescription drug costs have gone sky high. And 45 million Americans in 2017 said they didn't fill a prescription because they couldn't afford the drugs, and 22% of seniors. So again, we're hoping that with President Biden, he sees the Affordable Care Act as a starting point of which to build and improve upon. And these are the areas that certainly need improvement. But we know that if President Trump is to get reelected, we're going to see even a worsening of our healthcare system. Now, I'm just going to move forward to, as you know, we passed an awful milestone. 200,000 of our brothers and sisters and fathers and mothers and grandparents all succumbed to a disease. And just to show you that in the United States, those people that are on the front lines, the cooks, the drivers, the cashiers, the waiters, waitresses, majority of these people are uninsured, and you put them in the front line to fulfill basic needs, and yet they don't have coverage, they get sick. And it also points out that if you look at the deaths, as was pointed out before, communities of color were hit particularly hard with deaths per their population. And then on down below, if you look at the countries that have a universal healthcare system, like look at South Korea, look at their death rates compared to the United States. So if anything, I think, and then the other part is that 26 million people have lost their employer-sponsored healthcare during this crisis. So it's, if anything, it's magnifying all of the areas that have been under addressed and ignored in the last 4 years under the Trump administration. So I like to think of healthcare as a human right, not a job perk. But let's point out in the next 3 weeks, we have some very important things. As you know, actually in early November, the Supreme Court will take up a review of the Affordable Care Act to see if it's unconstitutional or not. And if they repeal the Affordable Care Act, that means there'll be 135 million Americans who will be denied coverage because they have a pre-existing condition. It'll do away with ban on lifetime caps, and it'll basically make life much more difficult because there'll be no maternity care, prescription drugs. All of these things will be much, much harder to afford. So just to point out that I think many people that you know will have a pre-existing condition that is on this list. So this is a real threat that we have to the existing healthcare system that we have. And especially among communities of color, this is basically showing you that if the ACA gets repealed, the uninsured rate among Hispanics will jump to 30%, 20% for African Americans. And you can see that our community is certainly not immune to this as well. But even if the Affordable Care Act is upheld by the Supreme Court, which may be unlikely, just to point out that President Trump has already passed budget cuts over the next several years that will give it a slow death one way or another. And this is just to show you that this is an independent analysis that the Trump healthcare plan would lead to 52 million people that are uninsured. And that's estimated it would cost an additional 200,000 deaths on top of the 200,000 deaths we've got from COVID. So just to point out that I think President Biden wants to build upon the Affordable Care Act. And the three main points that I think are very important to understand about President Biden is that he wants to have a government-run public option. It's not a government takeover of healthcare, but it's to have a public option. And the public option is actually quite good. If you are enroll in that, there will be no co-pays, no deductibles. In those states that refuse to expand Medicaid, those individuals would immediately be enrolled into the public option. And they would increase the tax credits. Right now, it's to 400% of the poverty line, well beyond that. There would be no cap. So the difference could not be more stark in terms of what we will get if we continue with the administration that we have, or what we will get under President Biden. And just to point out that, you know, when Jesus says, heal the sick, cure the lame, people view that as a socialist thing to do. But I like to always look at the book of Acts, because I think it really showed how a community came together and cared for the community at large rather than the individual, right? And one of the things that was from the book of Acts is that all the believers were together and had everything in common. They sold property and possessions to give to anyone in need. And it's the idea that we are all in this together. And that's really the way we need to approach our healthcare system, that we need to include our undocumented brothers and sisters. We need to include our greater community at large. And the first way we do that is by electing Vice President Biden to become the next president of the United States. Thank you.
Thank you, Dr. Song, for kind of outlining how policies really impact healthcare, especially for the AAPI community and our larger society. I know a couple of you mentioned different pieces or implications for the Asian American or AAPI community. I'm wondering if you, any of the panelists, if you could speak to, I think it says about 28% of AAPI elderly live under the poverty line, and also that the AAPI population is going to increase 145% between 2010 and 2030. So are there ways in which the non-healthcare field people should be engaging or thinking about policy or education? What recommendations do you have for us as we think about caring for elderly intergenerationally and other impacts of on our community in particular?
Is that for?
Any of the panelists.
Okay.
I'll just jump in here and have a try at it, Jana. I think in sort of aligning with what I started with, I think it is really having people at the table that are part of that community, that comes from that context. Otherwise, it's like two boats passing, again, to use a very oceanic motif. It's like two boats passing in the night. I mean, but it's having some policies that are from the bottom up that really speaks to the everyday relevant life and living of a particular people. I think it's just crucial. And as it is, if we continue to have this, this sort of top down, speaking down, we've seen it. So I think I'll leave it at that.
I will say right now, it's very crucial for those of you who have family members who are seniors to really get them to do everything to fill out the census, to register to vote. because a lot of the funding that comes, particularly here in the state of California, is going to be predicated on how many people are here. And a lot of Koreans were small business owners themselves, and as they get older, they retire. A lot of Asians in general, so they may not have had the best healthcare all along, but now they become 65, and at least they are maybe Medicaid, Medicare eligible. But that system will be chronically underfunded unless people are counted in the census. So I think for everybody, they can really get even their elders to fill out the forms. That would be the first step that I would say to really help improve that. Second thing is, I think they need to understand how the enrollment in Medicare and Medicaid HMOs and things of that nature. And I think community centers are very much there to help navigate people through that as well.
And from
I believe, as by and large in the Pacific Islander community, the church is the center of their life, and it's the church that we embrace the spiritual holiness as well as social holiness, and it is a place where that is crucial for a lot of the folk that do not know or need to be heard, so the church becomes vital in this whole process, to connect them to the services that are needed, but also to help lay policies in our political arena that will make a difference in the welfare and the health of our communities. Because I know for Asians, and especially Pacific Islanders, the church is where they seek refuge, and is a sanctuary where they know that they will be well and taken care of. And so I think those of us in the church have that responsibility to be that connecting network to health, and also to be the voice of health for our people.
So for the people of faith, we're very fortunate, like Hirola just mentioned, that the church can be a really good support group and resources. For me, I'm in between the faith community and the non-faith community at large as well. And prior to COVID, I would go and do volunteer at senior centers, and I think that's a very good place for seniors to gather. Not only they're lonely, they don't have their children who are busy or whatnot. There's not a lot that are specifically geared toward Asians population, but in the Long Beach area, there was one that they were doing things more culturally more appropriate. Even the lunches that they would have, they had two. One is Western and the other one's more Cambodian. So they would order the food from the restaurant nearby, and then the senior only pay a very reduced price to have that. And they were really flourishing, and it was a healing place for them because they're non-faith based, but that's the social gathering for them. And because, like you had mentioned, Jana, that their income is very fixed, and some of them are fortunate to be in housing, like for seniors, where they don't have to pay a lot and they have really nice establishment. There are others who are either have to rent from their children or from somebody that they know, someone that they know. And so sometimes they don't have a good nutrition food. So this location was really helpful for them. And I would hope that, something, some sort of programs like that, resources like that available, and more geared toward how, that particular ethnic group function or socialize, or how they do things. And we would go in sometime even give an education about health talks and stuff. And I'm sure Dr. Paulson would kind of relate to, access to this kind of program is a very good, important step to help, bridge the gap of inadequacy, or, and in this case, the income gap can be provided by ally resources. And I think that is important as community partners to help jump in and help.
Thank you. Thank you all very much for sharing from your heart and also from your expertise. At this time, I'll turn it over to Hyepin.
Okay, well, thank you again to our panelists. If there are further questions, then I'd be happy to pass that on. At this time, we're really privileged to have Bishop Grant Hagia share his reflections of today's panel and our topic, as well as bring us blessings for this session. And then we will introduce Josh Biden, who is the National Faith Engagement Director for the Biden campaign. Bishop Hagia is also an expert in many, many areas, but he has his doctorate of education at Pepperdine University. He's a professional coach and leads in so many ways. But for me personally, I just feel very grateful to him for two reasons. I remember before he became bishop in the recent years, his name came up for candidacy many years back. And it was down to these two candidates, himself and one others. And instead of being competitive, he actually relinquished and gave it to the other partner, the other candidate to become bishop. And I'm grateful that many years later, God allowed him to be appointed as bishop. So I really appreciate, again, his humility and, again, the focus of what is important. Most recently, I told you that I run a nonprofit called Faith and Community Empowerment. And it's been my passion that Christian leaders, churches, right, can truly be that light in the world. And I've gone to seminary, and I know that there are certain places where our church leaders are not equipped to be able to be effective in engagement with the broader community. And I was so grateful that Bishop Hagia also recognized that, and we've been able to partner on a program called the C2 Leadership Institute. But now I just want to say again, with gratitude, Bishop Hagia, take it away. Thank you so much.
Thank you so much, Hyp. And just to give you a quick recap, which impressed me so much. One, to give kudos to our leader, Hyepin, who provides such connection for our Asian Pacific leadership and community. So thank you. We were deftly guided by Reverend Doctors Jenna and Al, and their expertise in processing. Deeply grounded with Reverend Pula's prayer. And then the panelists were wonderful. Mona Lisa Tuatahi telling us about the invisibleness of our PIC community and how they suffer at a higher rate than anybody in this nation. And then going to Dr. Christina Lee and her understanding of the Cambodian, which really points out how different our own sub-ethnic Asian communities are. They have their own identities and own cultural dynamics, and that has to take place in our understanding of health. And then finally, Dr. Paul Song's stark statistics that provide the medically moral values in undergirding this election, and how important it is for us to really vote with our conscience and with our moral values as much as anything else. So I just want to end by just saying in the about 300 churches that I oversee, we're seeing many of these trends that you talked about. Two groups, though, that I've been especially hard hit in the COVID-19. One is our Black church members, who with every new incident of police violence or injustice, grow personally more fearful for their very lives. And the other group that's especially hard hit is our Asian Pacific church members, who because we have not allowed them in-person worship experiences, have been cut off, as Reverend Pula and Mona Lisa have told us, from the social bonds that they have counted on. Because of the relational and family cultural bonds of our Asian Pacific church members, not having this anchor of weekly and even more than that, attendance in a church has really been difficult and dislocating for them in general. So it's with profound gratitude that I thank the organizers and the participants in this forum. I hope we can continue to address some provocative ways to help all of our communities. And I know that this is broadcast to many other sub-Asian communities, and we really hope you will stay in touch and help us help each other, because that's the one constant in our cultural understanding. Community makes the largest difference. Join me now in a closing prayer, and we'll get back to finishing up.
Okay.
Gracious God, we come together today with humble hearts, dealing with the many pandemics and 3 earth-shaking trends facing us in the West. The continued march of COVID-19 and the needless deaths that are taking place. the call for justice and police reform in the Black Lives Matter movement, and the continued deterioration of the environment manifest in our destructive fires in the West. Never has the stakes been so high as a nation in this coming election. Move all of us to get out to vote, to encourage our people to vote, and to seek truth over lies, unity over division, and justice over self-interest. In the name of the one you have sent. Amen.
Amen. Amen. Thank you so much, Bishop Haggia, again for your powerful, inspirational prayer. At this time, it's my pleasure to introduce Josh Dixon, the man who started all this and responsible. He is the National Faith Engagement Director for the Biden campaign. I had the opportunity to connect with him when he was working for the Obama administration as the director of the White House Faith Base for the U.S. Department of Commerce. And we as an organization were hosting our National Lighting the Community Summit, where we were bringing Asian Christian leaders to engage in the greater public space to find out what resources are available, partnership opportunities, and to advocate for our community. He comes from a combination of very original conservative roots to then broadening into also the greater space. And so again, he brings unique gifting and unique passion, and very, very grateful for Josh Dixon. So Josh, would you be able to say a few words on behalf of the campaign? I do want to highlight that just all our different panelists were able to share just kind of the unique challenges that face the Asian community, and also with Dr. Paul Song, you know, what is at stake, right, if President Biden was not to win. And it has such a huge impact on the Asian community. Particularly, I want to highlight what Dr. Christina was saying in terms of, you know, even for my mom, she had cancer and high fever. But when she met with her doctor in Idaho, he said, "Oh, here's some aspirin, go home." And literally, it was only when she came to LA to see her Korean doctor that they discovered that she had cancer. It was related to the liver disease. And so again, hepatitis is one condition that many Asians are disproportionately impacted, but I would say the Western medicine, Western doctors don't know to be able to be look out for that. So there are these kind of different disparities that Asians face that our current system does not. And again, if President Trump was to continue all the, whatever we have, even that will be at risk as well. So with that, I'm going to pass it on to you.
Thanks so much, Hyepin. It's great to be with everyone. Sorry I was running a little behind. I had 3 events at the same time tonight. So you know, there's a lot happening in the campaign right now for good reason. And, you know, as Hyepin said, I have the honor and privilege of serving as the National Faith Engagement Director for the Biden campaign. And the one thing that I will dispute that she said is that I got things started because she was the one who started bringing people together to really build a robust group of AAPI Christian leaders who are deeply committed to justice, to righteousness, to peace, and who we've been meeting with regularly and working to engage and include, and whose voices we've been looking to amplify in every way possible, because they're speaking so much important prophetic truth. And for me, as you know, Hyepin mentioned, my Christian faith is a really important part of who I am. It is a central part of who I am. I was born and raised in a Christian family, and my dad and his siblings, his parents and my great-grandparents all went to Moody Bible Institute. So I grew up going to church twice on Sundays and once on Wednesdays, and was a Awana kid, and was involved with Campus Crusade for Christ in college. My wife was involved in InterVarsity. So, you know, we cover both. You know, we don't want any rivalries here. But I'll say that, you know, for me, following the calling of Jesus into service has just been you know, I think was a real turning point in my life after college. My first job was as a teacher in a low-income school in the south side of Chicago. And that was really where I think the words of Luke 4, where Jesus unrolls a scroll and talks about his calling, really became real for me, in seeing all of the ways in which systemic racism and injustice plague so many people, and are such a reality, and the burdens that so many people carry in our country. And I think that the work that Hyepin and so many folks on this call are doing is incredibly important. As a campaign, we are deeply committed to building a robust, diverse, broad, and inclusive coalition, and it is a central priority for us to ensure that AAPI voices are a key part of the table that we're setting right now. We have been working really hard to ensure that, for example, in our racial equity policy, we're spelling out the disparities that are impacting AAPI communities across the board. I know that y'all have been talking about healthcare tonight. That's a thing that is very much top of mind for so many people, especially in the age of coronavirus, especially with everything happening with the Supreme Court. And so, that's something that the vice president should be committed to, in ensuring equity, access, and affordability. It's also something where, we want to ensure that the disparities that you all have been talking about are acknowledged and are taken into consideration as any policies being put together, which is the same approach that we're going to have on any issues impacting the AAPI communities. I also know that AAPI communities are very diverse. My in-laws are from Hong Kong, and I lived in Houston for a bit and saw the diversity of the AAPI community there. My wife is from Sugar Land, and so folks in this call probably know, or a lot of you know, that Sugar Land is one of the most diverse. It's in Fort Bend County, which is one of the most diverse counties in the country. So, I think for me personally, as well as for us as a campaign, we understand that there are so many different layers, and that it's very important to be intentional about reaching out and connecting with and listening to and partnering with communities across the board. And so we're deeply committed to that within all of the diversity of the AAPI community. And I think it's especially important that AAPI Christians are elevated. So many of my friends come from the AAPI Christian community. So many of the people I've worked with during my 14-year career have come from the AAPI Christian community. So I'll just say, as a promise from the campaign, we're deeply committed to working together, to partnering together, and to ensuring that, moving forward, we're operating as a coalition of folks who are committed to those issues of justice, of being our brothers and sisters keepers, of loving our neighbors as ourselves, and collectively working to bend the moral arc of the universe more towards justice. So thank you for having me. I wish I could have hopped on earlier, but I'm glad that y'all were able to have a good conversation tonight, and just very much looking forward to future events and working together, most importantly, working together. And I'll just say, we need you. We need all of you right now. Number one thing you can do on the campaign side, first of all, you can register to vote, and you can get your ballot at iwillvote.com. But you can also, we need your time and your talents. And we'll send around a form after this where you can volunteer to give 4 hours, to give 4 days, to give 4 weeks. But that's what we need more than anything else, is we need people to donate time and talents, either virtually or in person. It's totally up to you. But we have battleground states where right now they will decide the election, which will decide the future course of our country, which will have so many impacts on, are we going to be a country that denounces white supremacy or not? Are we going to be a country that has plans to address public health crises that take the lives of 200,000 and counting or not? Are we going to be a country that seeks economic justice in a way that is focused on opportunity for the most marginalized or not? And so many of these things are on the ballot, but even more so is that idea of, who are we as a people? Do we love our neighbors as ourselves? And I think that's really on the ballot too. So we need you. We'll send around a form where you can sign up to help out in any possible way. We'll look forward to working with you on that. And with that, I'll turn it back to Hyepin.
Thank you so much. I just wanted to, yes. As you can see, our faith may have been hijacked by certain evangelicals, but there are many of us under this roof, umbrella of believers, right, that have not sacrificed our faith, and that we care about all these issues. And so if you identify as a Democrat, that we have every right to be out there, to be equally vocal, to be a witness for God in terms of being a loud advocate, right, for all these issues that impact our community specifically, but also for all those who are voiceless, who are hurting, and who need our voice and presence. I wanted to just open up to see if there was any question, a very short Q&A for Josh in any. Well, Josh, I think you did a great job for representing the Biden campaign, and again, being a great model for us that, again, the Democrats, the Biden campaign is committed to the faith community. And I have to say, you know, when he's doing 3 events
just
a day,
trying to follow your lead, Hyepin.
I have to say, I mean, he's literally just, I don't know. I think it's like 10 events a day. And he's on a roll. So again, you know, as Josh mentioned, there's many opportunities. We literally have about 30 days, little over 30 days before the
33. 33, yeah.
Oh my gosh. Before the fate of our country, and in some ways kind of our witness, right? Our ability to be a witness will be decided on November 4th. So we need every foot and hand and voice out there. And so there's various ways that you can get involved, and we'll be sending out a link after the fact to be able to sign up for the whole Biden campaign. In addition, we have our own listserv, and Hannah, I believe, has been putting it into the chat room where you can sign up for our listserv. And then also, in addition, there is a Facebook called AAPI Christians for Biden that we welcome you to join, because we are continuing to put out information that I think will help us put out the word for all our neighbors to also decide. And then we have 2 upcoming remainder town halls. So one is on immigration, and then the second one, the last one, will be on economic justice. And I think, again, in this current COVID environment under this administration, we're all going to be heavily impacted, if not already. So many people are hurting. We need your voice and participation as well. So again, a big thank you. Are there any last minute comments for any of our panelists or speakers? Josh? Then I just want to do a shout out to James Cho, who is doing the Facebook Live for us. It will be on recorded, and it will be on our AAPI Christians for Biden. Hannah Lee, who's been doing a lot of the heavy lifting, and also Dr. Jeffrey Kwon, who's been very much at the beginning, as well as quite a number of our AAPI Christians for Biden Advisory Council. So let us know if you want to be involved. Like I said, 33 more days and we will be going. All right. Well, thank you so much again. God bless you. God bless all of you.